Well, hi everyone. I'm Spencer. I'm host for this room. As we get started, just a couple of Clubhouse pointers. You can use the share button at the bottom of the room to share on social media, on the app itself, or directly with people that follow you. It's the button that kind of looks like the share attachment kind of logo. We ask that as many people as possible please share this room on Clubhouse itself, because that's like a really good way to kind of get the message out there that this room's going on and kind of raise awareness about this room in particular. Also, anybody that follows you or is in your community that might be interested in this conversation, we advise to try and ping them into the room, get them in the audience so that they can listen into this discussion. Be sure to follow everyone on stage and in the audience so that we can stay connected. And we highly encourage everyone to raise their hand as they see fit. We'll bring you up to the stage and you can ask your question or answer a question or hang around or contribute however you see fit. For those that don't yet know Consuli, broadly Consuli is a public benefit company with the mission to enable individuals to participate in the data economy. Experts suggest our individual data is worth about $20,000 per year. We do this by operating a marketplace for members where we become their agent and assemble patients' health records, labs, prescriptions, wearables, quality of life surveys, etc. Importantly, members receive Smart Match individualized offers for us for opportunities, including to participate in clinical trials and data trials. There's no cost for anyone to join our movement. You can learn more at consuli.net. Pinned to the top of this room is a really important research study for sickle cell patients. Consuli is pleased to share that it has teamed up with Sanguine Biosciences and Pfizer to support an important research study for patients living with sickle cell disease. If you or a loved one have been diagnosed with sickle cell disease, are over 18, and live in the U.S., if you qualify, you can contribute directly to sickle cell disease research from home and be paid up to $1,300. I'm going to be leaving that pinned to the top for the majority of the room, so feel free to check out for more information. You can also share the link and kind of if you know someone with sickle cell. So it's now my pleasure to turn the floor over to our room moderator, Elizabeth Dreicer, who is a philanthropist, activist, and co-founder and CEO of Consuli, who will be introducing our panelists and guests. Elizabeth, over to you.
Thanks so much, Spencer. And for your help and Glynis' help in making the event possible. Welcome. We're honored to host and facilitate this room. As we mentioned before, we aim to have the room be interactive, so please engage in the chat, raise your digital hand. We'll endeavor to get everyone that wants to join us on the stage to participate with us. So, and I know sometimes you get bounced out when you're raising your hand. So if that happens, just come back and we'll get you. Hopefully they fix that problem sooner rather than later. Just also mentioning that sometime during the session and when it happens, maybe Spencer alert us to when, we'll pin a virtual whiteboard. We've been curating a virtual public whiteboard that's capturing the core nuggets from this discussion from meeting to meeting, and it's designed to hold the bridge on issues on behalf of the many organizations and advocates and patients that have participated in this discussion as well as future discussions. So we're trying to hold all the learnings. As I introduce our panelists and guests, I'd like them to share what they perceive are, the most important things for us to be thinking about at this moment. And with that, let's see who we have. I'll start with Michelle. Michelle, welcome. Michelle is an international speaker and the CEO of Next Level Promotion. She's also a sickle cell advocate and co-creator of the Sickle Cell Foundation. I'm turning the mic to Michelle for her opening remarks. Michelle, the mic is yours.
Hello, good evening, everyone. Thank you for having me again, Spencer and Elizabeth. Definitely enjoyed this platform and being able to be a panelist to evoke the change that we would like to see when it comes to the sickle cell support system. Pretty much what I would like to see and what's necessary is change. And basically education, education, education. We cannot stress that enough. We discuss this, weekly, why it's relevant and, the importance of it, because a lot of people are still, misinformed as to what sickle cell anemia is and the various types of the disease and why it's very important for you to get tested, especially when you are embarking on a marital relationship and considering having children, because again, prevent to me is better than cure. you know Give someone a choice as to whether or not they're able to handle the heaviness of what comes with this disease, especially with the SS. It's so much, it's a lot, and not everyone can handle that or are fully equipped with knowledge or the financial backing or the support system to maintain sanity when dealing with certain things. So this is why I'm a strong advocate. My mom suffered with SS full blown. I have the trait. And, my drive is to just ensure that, or people or family are fully educated on what this disease is, where it stems from, because I get tired of hearing, from many, 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 sickle cell warriors and, seeing it firsthand with my mom. Oh, well, how did you contract this? Or when did this start? Where did this come about? So it's just lack of education. And as we mentioned last week, it needs to be in the schools, you know, involved in some of the sex educational pamphlets, plastered all over the clinics, etc., and having the emergency room educated as well, because they are not very knowledgeable when it comes to how to give the proper treatment when it comes to, pain management, et cetera, et cetera, et cetera. And of course, funding is always great to continue in the research for more cures that can benefit everyone, because we know that the ones that are here right now, there are still pros and cons to it. So that's why I'm here. That's my drive, and I'll land there.
Thanks so much, Michelle. Really good to have you. And hi, Dr. Rowley. Good to see you as well.
Hello.
Glad you could join us. And actually, I'll introduce you now as well, and then I'll come back to our other panelists. Dr. Rowley is a sickle cell warrior. She likes to refer to herself as a sickle cell gladiator because she sees herself as more than a conqueror. So Dr. Rowley is an author and an educator. Her children's book on sickle cell, Tanwa, is going to be launched in June 19th, actually, on World Sickle Cell Day. I'm turning the mic over to Dr. Rowley for her opening remarks. Dr. Rowley, the mic is yours.
Oh, hey, thank you so much. Thank you. Hi, everyone on the panel and in the audience. I see we have more people in the audience today. Whoop, whoop. That's nice. So hi, guys. I'm a 54-year-old sickle cell warrior. My parents found out that I had sickle cell when I was 2, and they did not expect that I would live past the age of 10. But I'm 54, I'm still here, still slaying the sickle cell dragon. I have 2 beautiful daughters. Thank you, Spencer. I have 2 beautiful daughters. They're 22 and 26. They both have the trait. I was smart enough and confident enough to know that I would not pair myself up with somebody that had a trait and have the possibility of having children with sickle cell, because I did want to have children. And pregnancy was very, very hard. I don't know if that's the topic we're talking about. Oh, we're talking about health and equity. Okay, so health and equity for me, health is not equitable, or the health, um, like medical leaves, or what do you call it, sick leaves, is not equitable. I discussed this last week where I said, like, where I work, everybody gets 7 sick days, but most people use the sick days for having a hangover or having a headache or just don't feel like coming to work. I have to save my sick days, because when I use my sick days, I use it because I'm really sick. But I do a lot of stuff to keep myself well so that I'm not having to deal with, you know, sickness, having to deal with a crisis, or having to deal with an infection. And with an infection comes a crisis. With everything comes a crisis. So I always try my best to hydrate myself, eat right, and, minimize my stress level. So yeah, I'm Dr. Rowley, and I will yield the mic for now. Thank you.
Thank you, Dr. Rowley. Appreciate your being with us. And next up, I'd like to introduce Sophy Yohannan. Sophy is an international medical graduate with 19 years experience in clinical research in multiple roles at investigational site and sponsor levels. She is a patient advocate, has worked in many therapeutic areas, including integrative medicine, neurology, psychiatry, gynecology, oncology, and cardiology. I am turning the mic to Sophy for her opening remarks. Sophy, the mic's yours.
Thanks, Elizabeth, and thanks, Spencer, for having me today. So, as you heard Elizabeth say, I have a lot of experience in clinical trials in different therapeutic areas, but not necessarily sickle cell. So I'm here for two reasons. One is to advocate for patients who need another option beyond standard of care. We have a lot in the way of clinical trials, experimental and non-experimental drug therapy for sickle cell disease, but we don't always access the right patients. We're not always the right people are aware. So how do we access that patient population? How do we make sure that the right people have the right tools in their hands? And it's similar for a lot of other very specific patient populations. But sickle cell is a very special condition that we have to sort of cater to this patient population. And if we try to treat every patient population the same, and we're not going to reach them. So, and the second reason I'm here is to learn from these wonderful sickle cell experts and people with personal experience, so that I can take that back with me and I can advocate for the people that I know, and I can spread awareness among clinical trialists I work with, the needs of these patients. So my name is Sophy, and I'm complete. Thank you.
Thank you so much, Sophy. Appreciate you being here, and I think it's always great to expand the surface area of people who are interested in working to help cross-pollinate across the patient advocacy ecosystem. So, okay, and Shakira, apologies that we don't have your bio, but I'd love for you to maybe say a few words about yourself, and then any opening remarks that you may have, particularly what you see as core needs in the community at this moment. The mic is yours, Shakira.
Hi, yeah, thanks so much for having me. I think it was Spencer that reached out to me on IG, so I don't know how you guys found me, but I appreciate it, and I'm happy to be here. I actually am a parent of two warriors. I have two children, 1 8, 1 6, who will be 7 on the 10th of May, and they both have sickle cell SS. And I actually started a organization called We Eat for Life that just talks about the positive effects of healthy eating and how it can help people with sickle cell disease. I found that one of the things that I was continuously asking my children's doctors when they first got diagnosed, when they were born, was, once they were able to eat like table food, was there anything I could be doing? Was there anything I could be doing that would be helpful? And I didn't really get any answers. It was, regular healthy diet's fine, regular healthy diet is fine. And so I decided to take it upon myself to do some research and ask a ton of questions. And I found out that depending on the foods you're eating, it could cause some inflammation in your body, which can in turn lead to a pain crisis. So we have been vegan since 2018, and I have seen a tremendous decrease in the amount of pain crises that they have, and their hemoglobin has been, fairly good, outside from them catching the flu, which a few years back, which was pretty tough. But they have been amazing, and we have had, great results from, healthy eating. So I think I'm gonna piggyback off of what Michelle said and said it's definitely education, 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 not just for the people who are suffering from sickle cell disease, or I want to say battling it and fighting it, but also the caregivers, and the ER. The last time I took my daughter to the emergency room, one of the nurses asked me, when was this a new diagnosis? And I said, excuse me, what? And they're like, "Oh, is this a new diagnosis?" And I was like, "It's sickle cell." I'm gonna need a different nurse. I'm gonna need a different nurse, because if you don't even know the basics, I think it can be really difficult to give the proper care. So I would definitely say education, 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 um, as well as more funding. Sickle cell disease is the most common inherited blood disorder in this country, but we do not receive the proper funding, like so many other genetic inherited diseases that are not as common as sickle cell in this country. So we definitely need way more funding than we do get. Um, and so I think that those are, for me, the most important things that I would want to say that we definitely
Thank you so
focus.
much, Shakira, and appreciate. Oh, sorry. Go ahead. You cut out for a second. I'm gonna let you finish. We lost like the last 15 seconds.
Oh, okay. I'm sorry. I was just gonna say that I think those are the main things that I would focus on. So it would be education on what, we could do as caregivers and as people who battle with the disease, as well as education in the ER, as well as funding. So I just think that those are the major things that we need to focus on.
Thank you so much, Shakira. Appreciate
Hmm.
that. And I just want to acknowledge we've got a number of new people to Clubhouse. They've got their party hats, so just give them a follow and kind of help them out. Glorious,
Yeah,
hi, I see that we have you joining the stage. I want to give you an opportunity to introduce yourself and also share a little bit about what has you be here this evening. The mic is yours.
thank you very much. Actually, my English is not that good because
You sound
I'm
very good to us, and
from.
we are very patient. So please feel
Oh,
free.
thank you,
You're very welcome to be here.
thank you. I'm currently in London, but I'm here for a treatment because I have sickle cell anemia. Uh, I just want to ask if you are doctors here or.
We have we have Dr. Rao here, and there may be some others in the audience. I'll ask anybody in the audience who's a doctor who wants to raise their digital hand and join the panel. We'd love to have you do so. But yes, Dr. Rao is here. Gloria, if you want to go ahead with your question, we'll see whether we can help.
Yeah, okay. I have a question.
Okay, sorry, I'm not a
Um,
medical doctor. I have a doctorate degree in educational leadership. So,
Good, good.
okay.
Okay, thank you, Dr. Rao,
So,
for clarifying that. So we'll see what we are able to, if we've got an audience member, just a strong invitation to join the panel. Okay, go ahead with your question, and we may not have the answer here, but we can certainly follow up. I know we've got a number of doctors in our cohorts.
okay. Now sickle cell patients actually live with pain. I'm living with pain since I was born. So now when I'm in pain, I don't show it on my face. But when I go to the hospital with that pain that is not showing in my face, it's not obvious that I'm in pain. No one will believe me, and sometimes they will ignore it. Thank God I am in a private hospital here, but I noticed that some patients get ignored because they don't show that they are in pain. They don't have to show it. They live with it. So why would people think that sickle cell patients will come to the ER just to take the medications or something? Please, I just want to know this
Yeah.
answer.
I think that you're not the only one that's had this experience. I'm going to open it up to the panel to share the experience. We've certainly heard this over and over and over again. I'll ask anybody on the panel to flash your mic, and then again, this is an invitation for anybody in the audience who has something to add. Please feel free to join us. Dr. Rao. Oh, I see you came off mute and then went back on mute. Guessing something's up. Michelle, Shakira, any
Sure.
insight on this? Shakira, the mic's yours.
Sure, I'll jump in. So I will say that there is definitely a stigma around sickle cell patients that they are drug seekers, even though it is absolutely not the case. I think it has a lot to do with the lack of education that Michelle and I spoke to earlier, specifically in the ER with ER doctors. A lot of the times the people in the ER just are not as aware of the disease. And so when you come in and you have pain, like I said, they don't really understand what everything is happening. And so not only do they not think that this pain is severe, is that so many patients are saying, but they also don't understand the magnitude, and it can affect the patient and the person in the ER. It is absolutely wrong. And that is so unfortunate that we have to battle these things. And, while we're in pain, we're trying to let people know, like, hey, this is what we're doing, this is what we're dealing with. And we're like almost to the point where you have to like somebody to believe you. And it is horrible. And I'm so sorry that you have to deal with that. It's something that I have not met a person with sickle cell who hasn't had to deal with it. And it's just so frustrating. Um, and honestly, I think the only way for it to get better is education. There has to be some sort of
Exactly.
better education in the ER. I used to work with Be the Match, and it's the National Bone Marrow Registry, and at one of the events, a nurse came up to me and she was saying that she was an ER nurse, and she was really, really wanting more education on sickle cell because she was like, they honestly didn't teach me anything, and we do the same checklist routine for every patient that comes in, but not every patient necessarily needs that same exact thing, because having sickle cell, it does affect you differently depending on who you are. I have two
Yeah.
kids with it, and it affects them totally differently. So I just think that it's a really unfortunate situation that we often get put in, and I hate that that's something that we still have to deal with now in 22.
Yeah, and Dr.
Oh, hi. So, from my experience, people with sickle cell have a high pain threshold. So, what we can tolerate, what somebody else would call a 10, we have lived it so many years that to us is probably a 4, right? So, when you go to the ER and you tell them that you're in a crisis, one of the first things you want to insist on them doing is to do a blood test. So, even though your face is not showing that you're in pain because of your high pain threshold, once they do the blood test, they will be able to see the breakdown of the red blood cells. They can see how quickly your red blood cells is breaking down. They can see your retic count, right, and the hematocrit. and that way they can tell. Plus, they can also see that your hemoglobin level is low. So, for instance, my hemoglobin level, my baseline is like 7.5, and the
Mm-hmm.
average woman's hemoglobin level is between 12 and 15.
Yeah.
So mine is 7.5, and I know it's 7.5. So if they come and tell me it's 7.3, I know I'm in a crisis, but I don't want blood transfusion. But if it's like 6.8 or it's at 5, then they know
Yeah.
already that
You have
I'm in
to
a
take it.
yes. One, they have to give me blood. Two, I'm in a pain crisis. They have to give me, pain medication.
Fluids.
Yeah,
Yeah,
but one
fluids,
good
pain
thing, what
medication.
what what you should do if you're going into ER, I know it's different in England, but I used to live in England, so I kind of still think the system will be the same because NHS doesn't change that much. In England or even in America or in Canada, if you're going into the ER,
Mm-hmm.
make sure you notify your hematologist, okay? So that your hematologist can either call ahead of you going into the ER so that they're expecting you, okay? So by the time
Yes.
you get to the ER, they know that you're on your way. But if you're not able
Yeah.
to do that, once you get there, still let your hematologist know so that somebody is advocating for you, okay? But
Yeah.
unfortunately, yeah, go on.
I'm actually, thank God, I'm in private hospital. So, anytime when I'm having the crisis, they just come and take me. I go to my room in the hospital, and they start doing what they usually do. But um, now I'm 28 years old actually. I'm from Qatar. I'm not from London.
Oh, mashallah.
I'm here only for treatment. So um, I actually also asked my doctor if I didn't take the bone marrow transplant this year, what could happen? What could happen to me? He told me I'd have 3 years only to live.
Only God
Why
knows
is
how
that?
long anybody knows how to live. I
Yeah,
mean, how
no,
long?
no one, no one.
Yes.
But why did he have this answer?
Well, I can't really answer for him, but what I think is with the bone marrow transplant, that's like one of the ways they use it now to cure sickle cell. You know, that
Yeah, I
way.
know.
So maybe they're trying to get you. If you have a match, like
I did
60%
have a
match,
match.
70% match,
I
and
did
the
have a match, unfortunately, but it was my little sister. Then she grew up. We were late a few years. Then we find out that she also have sickle cell. So now she cannot be the donor for the bone marrow transplant. And now what the doctor said that it's either my mother or my father. It will be not 100. It's not 100% match. It's if it's from the parents, it's 50% match and 20% death possibility. So
yeah, 50% match is usually good enough, but I didn't know it was that high fatality. But
yeah, because I'm 28 and my body is not in a good health. My body actually, I'm my doctors in Qatar did not explain to me when I was young what medications I was taking. I didn't know that I'm taking drugs. I didn't
can
know
you
that
send me
drugs.
can you send me a direct message so that you and I can talk about this offline, right? Because I think I have a few answers for you. Yeah?
Yeah, okay, sure.
We don't take up too much of the time. Okay, so send me a message and then, I'll follow up with you.
Thank you so
Okay,
much, Dr. Rowley, and thank you, Glories,
thank you. Thank you.
for sharing your experience. And I'm so sorry that you're going through this. Words are not enough, and
No,
obviously,
it's okay. Thank you.
no, but we're really glad that you're here and that you're sharing. And the hope here is to inspire solutions, some of which are perhaps delayed, but we need to keep talking about these issues and work towards a resolution on many different fronts.
Yes,
Um,
yes, yes. Sure,
I want
sure.
to,
Sorry.
yeah, thank you so much, and feel free to stay on the stage and join the conversation. Shakira, I think I saw you go to your phone. Did you want to jump in here as well? I'll just give you a minute. Okay, seems like you're on mute on that. And this is just an open invitation. Anybody in the audience that either sickle cell warrior directly or advocate or parent, please feel free to raise your digital hand. We'd love to have you join us on the stage. So I know that the last time, and Spencer, as anybody raises their digital hand, please just invite them up and we'll go from there. Also, just a reminder, follow each other in this room just so that in future rooms, that are on this topic, you can get pinged in. So follow all the people on the panel. Also, look around in the room and let's make sure that we knit the community together as much as possible. So some of the questions and dialogue that we had last week, we talked about just the whole panoply of things that are needed, from education, and that education is everything from doctors to nurses to, ERs to the care team, also then to the individuals, and figuring out how to have this be more well understood. Also, we touched on the research needs and the state of research. Hopefully by the next time we're together, there is a company called Vertex CRISPR that's working on some stem cell innovation in this regard. So really excited to hear what they're thinking and what the opportunity might look like. So just know that that's part of what we'll be examining here in the future. And there'll be others as well. I know we've identified the pipeline of research in this venue. And Sophy, I'm not sure, before I go too far into my narration, I'm not sure if you are familiar with what research is coming down the pike, and if so, would love to hear your input.
Yeah, Elizabeth, I know that there is a lot of stem cell research in multiple different therapeutic areas, including for sickle cell anemia patients. But I'm not intimately involved with that because I'm working in cardiology therapeutic area right now. I do know that sickle cell anemia patients and clinical trial participants are among the toughest populations to reach because they are not always aware of their options, and we are not always using our community leaders, community outreach, in order to reach those patients and let them know what's available to them. So I would love to hear more about that. What the different companies are doing to reach these patients in the communities, and not just advertising in hospitals or the drug advertisements, but in the community, really boots on the ground um, type of outreach. I think that's where the answer is.
I'd love to hear the panel and anybody from the audience join in on that. So Shakira, Michelle, Dr. Rao, Sophie's question around how do we get this population aware of research that's pertinent to them, and what you're seeing working. Maybe I'll just start randomly. Sorry. I'll call on you. Dr. Rao, What are you seeing as working? What's not working? Where can we be suggesting improvements?
Um, well, what I would say about that, it just depends on where you find yourself. There's not a lot of advocacy work happening. There's not a lot of community awareness on sickle cell. And I'll use myself as an example. There was a time I was getting blood transfusion every 3 months. And because my insurance and the hospital I use were kind of fighting, I had to find another doctor, which was a good thing. I did not know it was a blessing in disguise. So this new doctor knows or knew about a medication called Oxbryta. And after I had the blood transfusion in December, he decided to put me on Oxbryta. And Oxbryta is Oxbryta. It's a new medication that FDA just approved a couple of years ago. My old hematologist did not know about it, which is kind of crazy. You would expect that in the medical community, they would even talk amongst themselves. But he did not know about it. But anyway, to cut long story short, I started Oxbryta in December, and December has been the last time I've gotten blood transfusion. As of beginning of April, my hemoglobin level was up to 9.2, right? Which means this medication works. It helps to stop the body from sickling. Now, talking about the stem cells, I actually tried getting on the stem cells treatment about 5 years ago, and I went through all the DNA match and all whatnot. But they came back and told me, "Oh, I'm not a good candidate because I'm not sick enough." Really? But how did I even get on their radar? Somebody that I knew had done the stem cells treatment and told me. So it wasn't like I found out on the news or I found out in a paper. It was word of mouth. So there needs to be more, you know, talk about this. And I think this is what we're beginning to do here now. And a lot of the sickle cell advocacy groups, like, sickle cell in England and in Houston and in Atlanta, everywhere, they need to do more. And they're not doing that much more. Perhaps because they don't have the funding. I don't know. But I remember in 2021 when the COVID vaccine just came out and I had to go to work and I was scared. I contacted the sickle cell organization here in Houston and they were like, okay, we'll get back to you. They never got back to me. Even though I'm immunocompromised and I have to be one of the first people to get the vaccine, they didn't help. So I don't know. Maybe from here we can do more for our community and for people. And that's why I've written my children's book and I'm starting to do more in the community because I want to be the change I want to be. The change I want to see. Sorry, I have to be the change I want to see. So yeah, we're doing that now. Hopefully in the next 5-10 years, it will get better. Thank
Dr.
you. I'm
Rao,
done
you
speaking for now.
touched on a critical point there, which is, at least in this country, in the US, our lack of communication between providers, drug developers, and partners. One of the main issues is the multiple different electronic medical records, the charts in different hospital systems, even within the same state, even within the same city. So providers are not necessarily discussing options with each other. That's why you'll find hematologists and providers who sometimes know about options for treatment, including clinical trials, and you'll find others who don't. Others with the same amount of experience who don't know. And that's where I think some of these advocacy groups, these community groups that you're talking about in different geographies, really need to partner with the drug developers and third parties and the physicians or hospital systems in order to make sure that we are transmitting the same message across multiple geographies. And it's also rural geographies are not getting those messages because they don't have the same access to university hospitals or large academic medical centers. When we have community hospitals, that's where there's even more of an issue. And so these advocacy groups and support groups really need to partner with the drug developers and physicians in order to spread awareness at the same rate. How do we get there? I think that has to be part of the drug development process. That has to be embedded into the timeline. And until we do that, we're not going to be successful in reaching every patient who needs a different level of treatment. This is Sophie. I'm complete.
Yeah, Sophie, I mean, you're touching on so many different things there. I'll say let's put a pin in the discussion about the new FDA sort of draft guidance that came out last week. I know that we're going to have a deeper conversation, next week on this topic, but I think it's pertinent to what you're talking about, which is to ask pharma, essentially the developers that are, creating these new therapies, to make sure that they've got good representation in their trials, right? And they have to come up with a plan around that. Maybe you want to say a little bit about that, and then we'll circle back to your really other good question about like, how do we get more of the community engagement? We heard a little bit from Dr. Rowley, who said, look, you know what, we've got these organizations, but they're not as tight knit or as efficacious in areas that matter. And certainly in the scenario where you reach out to your association to get help, at an incredibly important level, and they don't respond, that sort of breaks the foundation of trust and relationship, right? So how do we strengthen these important organizations? Anyway, I know I've got 3 items on the table. I don't mean to confuse things, but Sophie, I'd love to get your take, if you'd like to, just a preview of what do you think about the FDA's guidance? Good, not good, too little, too late, not good enough? The mic's yours.
I think it's about time. It is about time. So the sickle cell community is only one of the communities affected by the lack of diversity in clinical trials. And it's not just clinical trials, by the way. There is a disparity in standard of care treatment across ethnicities, races, and geographies as well. It's just more marked in clinical trials because it's experimental, they're investigational drugs, and there is a lack of trust when it comes to investigational unapproved drugs. So it's just more a sharper difference in availability of these clinical trials to certain, underprivileged populations, minority populations, racial, ethnic populations, as well as geographic, patients who are located in more rural areas, away from large urban areas, and away from large academic medical centers. And the reason why the sickle cell population is very closely tied to this is because sickle cell disease is tied to ethnicity. We have certain BIPOC populations who are more affected generally by sickle cell anemia than other populations. So we have to, if we don't cater the treatment or the availability of drug or availability of clinical trials or any other options to these populations, we're never going to reach the right patients. And so the FDA has come out with this draft guidance for industry, kind of encouraging industry leaders to come up with a plan every time they design a new clinical trial, a plan for how they're going to make sure that underprivileged populations, underrepresented minorities, and racial and ethnic and geographic minorities are going to be represented in these clinical trials, that the ratio of majority to minority populations will be reflected as the same ratio of patients who are enrolled in these trials. And that's not going to happen overnight. It's going to take a while, but at least there should be, the needle should move, right? There should be a change happening. And how do we bring about that change? We have to have a plan. And then we have to have a plan to carry out that plan. How are we going to make this happen? And then we have to have metrics. We have to keep track of how well we are carrying out this plan. And if we don't see the needle move, we have to have plans for how we're going to correct that. What's our plan B? What's our next step? How are we going to reach out? How are we going to reach out to these patients? How are we going to offer these patients the treatments that they need? So there are so many options. There are so many things we can discuss. One thing, I'm just going to throw one thing out there, and then I'd love to hear from anyone else on the panel, is the issue of trust that I brought up before. A lot of patients, especially in BIPOC populations and in patients who are located in rural areas, away from urban areas, who have limited access to medications, to hospital facilities, and very limited physicians and healthcare professionals. They only have so many choices, right? So those patients are the ones that we really need to target. Those are the ones that we need to get to. But those are the ones who have the least trust because they don't have enough option. How do we increase that trust? Wouldn't you trust somebody who knows what you're going through, who understands you, your family, your lifestyle, the way you think about things, the way you go through life, and the way you work, your surroundings? Wouldn't you trust somebody who knows that better than someone who has no idea what you're going through and is trying to convince you to take a medication or try a clinical trial, right? So with that being said, I think part of the issue and hopefully part of the solution in the future is to increase the diversity in clinical trial professionals, in physicians. I'd like to see more physicians, hematologists in this BIPOC population, physicians who come from that community, who can then speak to that community, and the community will know that this physician understands them because they come from the same culture, the same community. I think that's one step, and there are many other steps I'd love to hear from the other panelists. This is Sophie. I'm complete.
Thank you, Sophie. You raised so many issues there, and we're going to get to the panel. I just want to also welcome Lupe. So glad you're with us. I just want to introduce you briefly. Lupe is from Nigeria, currently residing in Oakland, California. She's a nurse, became a nurse to give patients someone they could relate to beyond a textbook. She also started the nonprofit I Fight for Sickle Cell to spread awareness, support for sickle cell warriors, and to empower individuals to be conscious of their hemoglobin genotype. Lupe, glad to have you with us again. The mic is yours. Would love your opening remarks, and then we'll catch you up on we've got like 3 or 4 things on the docket here that we're talking about simultaneously. So Lupe, the mic is yours though first.
Thank you for the introduction. I'll kind of just listen in and jump in once you guys keep going.
Okay, let me see if I can paraphrase. What's on the floor is Sophie's great question about how do we get more community engagement and really solve this health equity gap. Shakira, Michelle, Dr. Rao, Shakira, I'm going to start with you this time, if it's okay. I'd love to hear your perspective on this. What's working? What's not working? What needs to change?
Sure. So I think one of the things we have to do is actually get in the community, like physically boots on the ground, like find out where, things are happening. So when I was contracted with Be the Match, one of my jobs was I was a community outreach manager. And so I was tabling at events where I knew people would be at. So, for instance, the Sweet Auburn Fest is here in Atlanta every year. It's a ton of people. And as we have talked about before, sickle cell does affect Black people far more than it affects any other race. And so Black people are going to be at the Sweet Auburn Fest. So we're tabling at the Sweet Auburn Fest and we're letting them know what we're doing. Even if we don't get a massive, crowd of people who have sickle cell, almost everyone we talked to knew someone that had sickle cell, whether it was a family member or a friend. And so I really think you have to be where the people are. Like, if you want them to know what you're doing, Be the Match has an amazing website with amazing resources called sicklecellconnect.com, but no one had ever heard of anything I was talking about when I was there, or like at any of the events I tabled at. And they do provide, resources like free counseling, and they provide like information on different clinical trials. But if no one has ever heard of you, then they're not going to know to look you up and find that information. And so I really think you have to be where the people are. And it may not be, something conventional, like, at the doctor's office. You can't catch everybody at the doctor's office, but you can catch them at a Juneteenth event. That's another place where we were at last summer. You can catch them at, places where LA Fitness. I was at several different LA Fitnesses within the Atlanta area, but that were predominantly, their membership was mostly African American. And so we have to literally go where they are. Like, you can't have these amazing programs and then not tell anybody about them, or only share about it on social media, when the majority of the people who follow you on social media are not the people that are affected, and they're the people who you're trying to reach. Like, you really do have to go where they are. And I think that's the best way to get the information out there. And it's so helpful. I can't tell you how many people that I've met with, partnering with different organizations and being the person like, no, I'm literally partnering with you just so I can be the boots on the ground person. And it's been extremely helpful. So I just think that you have to hire those people who are willing to be in the field and speaking to those people and comfortable speaking to them, and they are more comfortable sharing their personal stories when they know you have a similar experience. And I believe that's what Sophy was saying. You When somebody looks like you and they have had almost the same life experiences, they're more inclined to trust what you're saying. Um, so I just think we need more people. We need more of that, and we can never have enough of it. I think that's what I would say.
Brilliant.
Thank you.
Genius.
Oh, go ahead.
Jim, yes. Deli, yes. The people who know what your lifestyle is like. Wow, I couldn't have said it better, Shakira.
Thanks so much, Shakira. And Michelle, I'd love to get your input here, and then we'll go to Dr. Rao and then to Lupe. Michelle.
Sure, one moment. I was in the kitchen, so I
Oh,
apologize. Give
no
me one
worries.
second. Oh, no,
Yeah.
you're good. So, Shakira, absolutely concur with everything that you just stated. Um, I believe that education is key, as I stated, and I'm going to continue to reiterate and drive that point home, because that is absolutely what is lacking um, in society when it comes to sickle cell anemia. If we're not educated, one, we don't know how to move forward with getting the help for our warriors and for their loved ones. So, with that being said, I absolutely love that. I'm a part of the Sweet Auburn Fest, so hopefully you and I can meet up, because I'm also in Atlanta. And my partner and sponsor, the Apex Museum, does do a lot within the community. And my other organization, New Order National Human Rights Organization, we have a youth summit that we do each and every month, every third Saturday. And I invite people out to come and learn about history. And we have speakers that speak about anything from financial literacy. Brianna was in here last week. Of course, she is my partner with Majority LLC. She is the CEO and founder. I am her co-founder. We are working together to implement everything that we want to see done when it comes to sickle cell anemia. And with that, we have incorporated speakers coming to the Apex Museum to talk about this topic so that we're educating our youth and their families, because we see a lot of the youth now are very sexually active. And if they are not educated, we're going to continue to see people clueless about what's going on when it comes to the sickle cell disease. And when you have teens, excuse me, young adults, you know, being sexually active and not educated on certain things, like, we have the pamphlets, like I stated earlier, on, HIV and other STDs out there. We need more information so that we could drive the point home that everyone needs to be tested and they need to be absolutely aware of the sickle cell disease. And that is my mission, to make sure that this information is out. And all the partners that I've, you know, embraced, we are collaborating. And I love the word networking, but I'm in love with the word collaborate, because when you're networking to meet new people. But when you're collaborating, you guys are coming together as one, working cohesively to implement what you want to see done. So I'm going to land there, because I believe that there are some amazing people in this room and on this panel that are doing what I am so passionate about. And thank you, Shakira. I want to link with you so that we can start seeing more change, starting in Atlanta and throughout the nation, as well as globally.
Absolutely, absolutely.
I really appreciate all the comments, Michelle. And Dr. Rowley, would love to get you to weigh in here as well.
Okay, thank you so much, Elizabeth. Wow, Michelle, that was amazing. Shakira, that was awesome. I was just flashing my mic when both of you were speaking. It's like amazing. Collaboration is the key. Okay, so my response to the question now is going to come from a different angle. And it's about the way we as Black, so I'm Nigerian, okay? Before I became American, I'm Nigerian. In Nigeria, we believe, we have so much myth in the words you say. Oh, don't say you have sickle cell. Don't confess that you have sickle cell. That is not your portion. Yada, yada, yada. So there's a lot of denial in the fact that sickle cell is in our body. Okay, so fine. Maybe I don't have sickle cell, but sickle cell is in my body and it limits me, right? But people around us try to, you know, suppress us from saying this, because they feel like the more you say it, the more you're claiming it. So when you don't say it, why would you seek for help? When you don't say it, why would you look around to see who's providing you options, who's providing you answers? And like for me at 54, it took me a while for me to finally say, you know what? I'm stopping. I'm just going to stop. I've been wanting to write books for several years, and each time I start writing my book about sickle cell, people will say, "Oh, why are you writing about sickle cell? You know, it's not going to sell. It's not going to be." Oh, no pun intended. But it's like, um, write about something bigger that affects more people. But I had to get to a place where, you know what, this is me. This is what I was born with. This is what the Creator put in my body. So whether I like it or not, whether the next person likes it or not, it is what it is. So I'm writing my book on sickle cell to talk to people in my community. I don't care if it's 10 people that buy the book, but we need to come to the realization and the ownership of this is what we have, and we need to address it. We need to find ways on how we can live longer and healthier. People with sickle cell don't need to die by the age of 20 or 21 or 10. My younger sister died at the age of 2. She wasn't even 2, she was 1.5, right? But we need to come to the place where we live healthy, we eat healthy, we have a good mindset. And for us to get there, starts with talking, collaborating, and accepting that this is what we have and how we're going to conquer it. So, yeah, I'm done speaking for now. Thank you.
Thank you so much, Dr. Rao. And I just want to lift a few comments that I see in the chat. First, just want to acknowledge Monica Rockwell saying nothing for us without us, sort of a very important slogan in response to this. Just a reminder also for our new people that have the party hat, give them a follow, kind of share some love. Definitely helps as you're new to Clubhouse. And Monica, don't worry. I think everybody who started out didn't know what any of these buttons meant, but if you do want to raise your digital hand, I'm trying to figure out how you even do that. Spencer, how does somebody raise their digital hand in this new world order here?
So I think we can't see it because we're already on the stage.
Right.
But I think if you're in the audience, there should be a little hand logo of sorts to press to get invited up.
Okay, well, hopefully you
I
can
think
figure
Sophie's
that out.
testing it right now.
Oh, good. Sophie, did you figure it out?
Yeah, so I just moved myself to the audience so I could see where the hand was. It's in the bottom right corner of your screen. Everyone in the audience, if you look in the bottom right corner of your screen, you should see an icon with a hand. And if you tap on that, it will show that you are raising your hand, and then either Spencer or Elizabeth can bring you up to the stage.
Fabulous. Thanks so much. And I just see we got Brianna back. Welcome, Brianna. How are you? I'm glad to have you with us again. We've been having quite a discussion. I'd love if you have a moment to weigh in. One of the things that we've been discussing is by the way, Brianna is the mother of a sickle cell warrior and is a sickle cell advocate, author, and the CEO of Majority, LLC. I'd love to hear her thoughts just generally. And also we're having a discussion about what needs to happen in the advocacy community to increase awareness among the people who really need access to new information, new treatments, participation in research, et cetera, et cetera. I'm not doing you justice, Sophie, and how wonderfully and eloquently you addressed it, but Brianna, I'm going to turn the mic over to you.
Hi, everyone. Good evening. I'm sorry. My Wi-Fi has just been crazy tonight. So I'm sorry that I missed out on the conversation. But what a great, amazing topic. And thank you so much for the nice introduction. I think that we really need to teach these parents and sickle cell warriors how to advocate for themselves. No one really knows that, if they're having an issue with a particular doctor, what to do. I've heard a lot of stories about patients being mistreated. And of course, there are a lot of amazing doctors and nurses and healthcare providers out there, but then you have those that are not. And that don't treat you that well, but you don't know, people don't know what to do or what steps to take when that happens. So I think maybe um, explaining to them how to file a complaint or what to do, when these things happen. For instance, my son was in critical condition at one point and he was switched to a hospital in New York. And this nurse actually pulled his IV out twice in the same evening. And it was just because she was running back and forth between patients, which I understood the first time. And, I said to her, he was 18 pounds at the time because he was 18 pounds for 3 years. So he was extremely tiny and he was already having liver failure. And then the second time she pulled his IV out, she like literally just flipped him over, but she did it so rough that she ripped his IV out. So I had to go and file a complaint, and I know how to do these things because my mother, fortunately for me, was a nurse. Is a nurse, is an RN in hematology and oncology, and she used to be the head nurse of Essex and Union County in New Jersey. So where I am educated, I know a lot of people are not, and I would love for everyone to know what to do in such instances and how to escalate them so that they can be told to the right person.
Thank you so much, Brianna. Okay, so we're at the point of our conversation where thinking about our next meeting, I know we had talked about previously having additional researchers and hematologists here, and I know that our team is working hard to get, and we have a number of great suggestions that have emerged, and Spencer is, we anticipate that we'll have folks join us, and this will continue to get larger and larger each week as we just build this community. We talked a lot about having policymakers, also somebody from disabilities, legal, and a variety of others, but additionally, really understanding what the research pipeline looks like what's coming from a perspective of cure. One of the discussions that emerged last week was how important it is and how fleeting hope has been for many during what seems like a long period where there's been not a lot of innovation. So really interested in trying to lift what innovation is emerging so we can all be thinking about that and bring that to the fore. So I'd love to take suggestions, and just maybe we can go around closing thoughts, and also who and what type of individuals you want to see in this room in the future. I'll just go in no particular order, if that's okay with everybody, just because I'm going to refresh my screen and see what happens. So Lupe, can I turn the mic to you first? I'm just going in reverse here.
Yes, that's fine. I would like to see possibly social workers present. I love how Brianna, I believe that's how it said, mentioned teaching patients and parents like how to advocate for themselves. I think social workers are big advocates for people with sickle cell. I know my social workers have gone to bat in various situations for me, and they often know different tools and keys that can help people with sickle cell, such as like FMLA or how to file for like disability assistance in schools and things like that. Sorry for the background noise, that's my nephew. But yeah, those are my closing remarks. Thank you guys for having this again.
Thank you so much, Lupe. And if there's anybody in particular, I know that Spencer would be delighted to get connected. So if you have a particularly amazing social worker in mind, that would be fantastic. And we'll also just start looking. Dr. Rao, Lee, your thoughts, closing remarks, and also what other archetypes do we need in this room?
Thank you, Elizabeth. I think we need every type of person in the community that has any kind of connection to people with sickle cell. I think we need to continue this conversation and get people to talk more about, sickle cell, for people, warriors, to know where to find help, where to find solution. And, let's just keep talking. I mean, I came here for the first time last week, and I'm back this week because I was really excited about what I found here. So I think we should just keep doing that. Well done, guys.
Thank you. Thank you so much. We know it's a build here. Michelle, would love your closing remarks and also your thoughts on who we need to have in our future discussions.
Well, you guys know I'm very repetitive with how passionate I am about, continue the drive for educating everyone. And in regards to those that are in the room, definitely everyone that's here today, because each of you brought something else to the table from a different perspective. I'm grateful to see Brianna back. So yay, thank you for coming back and sharing your thoughts. And I believe, Brianna and I can even reach out to our immediate circles, such as who I mentioned earlier, the Apex Museum, Dan Moore Jr., invite him in the room because, of course, we have several things on that platform that we could utilize to get the message out. They do have the television network. We have several things that we're working on, I do have several other conferences. So just being able to spread the word and say, hey, you know, Consuli's here on Clubhouse doing an amazing job in the search for funding as well as, education, as well as, research. And this is something that we would love to share with you and have you also spreading the word and all collaborate to get that change and be the effective change. And I'll end there.
Thanks so much. Shakira, would love your thoughts, closing remarks. Same question. What do we need?
I think you all are doing an amazing job, and I just think I'm gonna say more of what you're already doing, reaching out to people, asking the people that you do find to talk to their networks. This has been an amazing conversation. I'm so honored that you all would have me here on the conversation with you all. I do have three people though that I think would be very beneficial. The first is Mapillar Dawn. She is the founder of My Three Sicklers. She has three daughters with sickle cell disease. And she has an amazing organization where she gives to the sickle cell community not only just resources and care packages, but also education. And so I would definitely say, if you all would like me to reach out to her, I will, because that is my sister, and she is absolutely amazing. I met her through networking, just finding, people who were doing with the same thing that I was doing. Also, I would say Dr. Z and Maya Bloomberg, they are amazing hematologists, and they have some great insight on just how tough sickle cell can be for patients. And their advocacy work that they do is really amazing. Maya posts a ton of different videos on TikTok and on Instagram, and they're very, very, very educational and informative. So I think that she would also be a great asset to the conversation as well. So, but just thank you all for having me. Thank you for doing what you're doing, because it is very, very needed for our community. So I really appreciate it.
Thank you so much, Shakira. And I am sure Spencer will be delighted to get those connects and invite all three to the next show. Really looking forward to that. Brianna, I'd love to turn the mic to you. Same question, your closing thoughts, and also what do we need here going forward?
Thank you again for passing me back the mic. I want to touch on what Michelle said. I think it's a great idea to invite Dan, but not just junior. I think senior too, because senior actually wrote a book on sickle cell disease. I'm not sure if you're aware. So I think that would be great. He would probably like to be a part of the discussion as well. And then I also have a few people that I've connected with on Instagram that I would like to reach out to. One guy's name is Jonathan Nelson. He does workout videos for people with sickle cell disease because he has sickle cell, and just tries to do like light exercises. And he does a lot of videos on that. And then I had like two other people in mind, also people who have sickle cell organizations. One mom who started a sickle cell organization because she actually lost her daughter a couple of years back, and I believe it's called the SK Love Foundation. And then there's one other organization, the Sickle Cell Consortium. I guess I would invite them too. I'm excited about everyone bringing in all these people so we can keep the conversation going and just build as much awareness as we can, especially with Be the Match, or maybe if we could get, get more awareness to organizations like Be the Match, so we can get, people with sickle cell donors, because 70% of the people that can get it don't have donors. And then maybe we could get a bone marrow transplant doctor on, like my son's doctor, Dr. Haight, was one of the first people to do sickle cell transplants, and he is about a year out now, and he's doing great. So maybe some information from a bone marrow transplant doctor as well, because I think a lot of patients with sickle cell are also afraid of it, but the risks are very low. Like I believe my son's transcranial Dopplers showed that he had a 30% chance of having a stroke every day. But the bone marrow transplant procedure only had a 20% chance of failing. So that is what made me, make my decision with going through with transplant. I'm sorry, I know that comment was a little all over the place, but thank you for having me.
Oh, no, it was so fantastic. And this is exactly the kind of information I know that I have no doubt that Spencer and Glynis are writing furiously and keeping all those wonderful suggestions. And I'm sure we'll be back in touch with you for those connects. And just so you know, Sickle Cell Consortium has definitely been invited. And I know that we are really looking forward to them joining here. And I should mention the other big cohort that will be coming is the health equity funders, major philanthropy. I reached out to grant makers in health, and equity is on like the center stage for big philanthropy, and we are going to make sure that they hear about this community and we get this engaged. Also, what you just said about the bone marrow transplant and the donor component, um, in addition to the doctors, I wonder if there's a bone marrow registry or any sort of, if somebody can maybe speak to who the right organization is that could speak to that so that we get more people to
Be the
identify as
Match.
donors. Is
Yeah,
it
it
just
would
Be the
be.
Match?
Well, Be the Match is the National Bone Marrow Registry. I worked for them for 2 years, so and I still have several connects there. And actually, a little bit earlier, I think Jermaine is out of there now, but he popped in when I shared it. He is a recipient.
Yeah,
He
no,
was a
it's interesting
recipient.
because I'm just thinking about I did a bone marrow transplant for a, a child who had neuroblastoma. I was a match for that, and I remember that process was really just through awareness campaign through my local blood bank. So I'm just
Hmm.
wondering what the status is if there's, but yeah, Be the Match, we can absolutely include them. And just if there's any other ideas about how to get the word out more broadly, just thinking, people who may not have sickle cell may not be thinking about this particular disease state, but are willing to be donors in general. I think it would be interesting to see if we could expand the awareness. I don't know what other people's thoughts are on that, but Brianna, I saw you came off of mute. Did you want to weigh in here as well?
Oh no, I was just gonna say Be the Match, but I'm sorry, someone else, I'm sorry, I didn't see her name,
Shakira.
spoke on it. So, Shakira, yes, Shakira spoke on it, so I muted again, but that was all I wanted to say.
Okay, great. Okay, well, good. All right. Any other burning item that somebody wants to say before I do the closeout? Okay, going once, going twice, going three times. Well, just really want to say again, deep thanks to the panel, the audience, including the chat, which I know got active here. And thank you everyone for engaging on all fronts. As I mentioned, if there's others who want to co-moderate, please back channel Spencer as well. And I just want to extend deep gratitude to the team of Spencer and Glynis for helping make this possible. Without them, we wouldn't be here. So I know they're doing a lot of work behind the scenes. And I am going to turn it back to Spencer for his closing comments. Spencer, the mic's yours.
Hey everyone. Really good conversation. Agree with Elizabeth. Let's get really important people in here, and I'll be in contact like this week, early next week, about how to reach those people. Appreciate anyone spreading the word about this room because it's super important to be having these conversations. In closing, I'm Spencer Gurley. I'm ambassador at Consuli and host for this room. Here's a couple announcements. In addition to this room, we also host a long COVID and clinical trials room. You can find us at consuli.net for direct questions, comments, feedback. You can find my email in my profile, or you can back channel me, whichever is easier. I'm pretty active on responding to people. Be sure to follow everyone in the room here today so we can continue to grow this community, ping each other when conversations like this are happening, and just continue to push this dialogue forward. For those that joined late and don't yet know Consuli, Consuli is a public benefit company with a mission to enable individuals to participate in the data economy. Experts suggest that our individual data might be worth $20,000 per year. We do this by operating a marketplace for members where we become their agent and assemble patients' health records, labs, prescriptions, wearables, quality of life surveys, etc. Importantly, members receive smart match individualized offers from us for opportunities, including to participate in clinical trials and data trials. There's no cost to join our movement, and you can sign up at consuli.net. Once again, pinned to the top is a super important research study for sickle cell patients. Consuli is pleased to announce that it is teamed up with Sanguine Biosciences and Pfizer to support an important research study for patients living with sickle cell disease. If you or your loved one has been diagnosed with sickle cell disease, are over 18, live in the U.S., and qualify, you can help contribute directly to sickle cell disease research from home and be paid up to $1,300. So that's our fourth room. Can't believe it's already been a month that we've been hosting these. Be sure to come back next week on Thursday, and we'll continue having this conversation.